Hi, dear followers and patients of our clinic. I'm Dr. Ahmedov, hair transplant surgeon from Smile Hair Clinic, Istanbul. Today we have one of our patients who arrived for the second surgery. It's Stephan.
Hi guys.
Stephan is our patient who had his first hair transplant surgery 3 years ago, back in October of 2020. He was actually one of the first post-pandemic patients where we were slowly getting back to the new normal. Okay, he traveled to us. Stephan, when he had first surgery, he was 64 years old. Here I want to answer one of the most common questions we get from our patients. What's an appropriate age for for hair transplant surgery? An appropriate age for the hair transplant surgery is the age between 18 to 60. In some cases we can extend it up to 65 or even 70. Of course, there are some criteria. There should be no chronic disease. The health condition should be in a good point. So we give the decision individually. So when we decided to get Stephan for his first surgery, his general condition, his health condition was perfectly well. So it was we were in a safe area. We should not be forgetting that the hair transplant surgery is an elective procedure at the end of the day. It's an aesthetic procedure. Thank God it's not the cancer surgery when we must do something. And if the risks outbeat the general well-being of the patient, it's better to postpone it or even cancel it in some cases. So Stephan actually had Norwood Type 7 of the hair loss, 6 to 7 actually. It's the most progressive and advanced type of the hair loss. It means actually, I can show the pictures. Here's Stephan when he first arrived here. This is him, the front side. You can see the front side is empty. There's empty spot in the mid-scalp and the crown area. So basically all three anatomic areas were affected in his case. It's progressive and advanced stage of the hair loss. Under the normal conditions for this type of patients, we may need the numbers between like 5 to 6, in some way up to 7,000 grafts to cover everything with good density. But I remember when we first talked with Stephan, he said, of course we explained to Stephan one of the fundamentals of the hair transplant surgery, that hair transplant surgery in its base is giving you an illusion or good outlook of the hair. It can never be the density or the hair the patient had, for example, when he or she were in their 20s. Okay, so we talked that we should, we will try to give him a good shade of the hair. And I remember his answer. Actually, he said any result better than it's now will be suitable for you. So we had to set our expectations really nice, but as Stephan told me when we were chatting just before the interview, actually, it's more than enough for him. Okay, so our plan was a two-step surgery for all the patients for the most of the patients actually, for the Norwood Type 5 and above. Most of the time we may require 2 surgeries. And with the first surgery with Stephan, we decided to first of all rebuild the front hairline, cover the front side, and go as much as we can to the mid-scalp. Because as a general rule we tell to the patients, the front side and the mid-scalp, or this area, is up to the 60 to 70% of the final outlook of the patient. Whoever sees you most of the time, they see you from this projection. That's why when you do the reconstruction of the front hairline, the front area, and the mid-scalp in a good density way, it gives really satisfactory results. And one of the advantages of reconstructing the front side and the mid-scalp is next. If you keep your hair slightly longer, as Stephan did actually, you can easily cover the empty spot at the back of the head as well till the next surgery. It actually took us around 3 years from his first surgery. Yeah, he is actually get older as an age, but as an outlook, he looks like Sean Connery at his best with the long hair. I remember from the film, The Rock, actually. So, Stephan, how was this years after the surgery? How do you feel?
Very good. I mean, my confidence is sky high now, really. Back 3 years ago when I first met you, I was probably at my lowest ebb as far as confidence was concerned, but now it's not something that concerns me at all. So I'm very, very pleased to be back to see if we can improve on it.
Yeah, okay, by the way, with the second surgery we planned with Stephan is actually to reconstruct the crown area to give it more or less better density. So you can see Stephan here. The biggest change that has actually occurred to him is the front line. The front hairline and the front area of the head is the frame of the face. Why the biggest difference or age difference actually comes at this point? Because the patient with the hair loss in the front side don't have the demarcation line or frame of the face. So the forehead actually goes directly into the scalp, so that actually a kind of border is gone. And it's like the whole, and it makes the patient look older than his or her age. That's very important. That's why for the patients, when they ask us if they can do, for example, do the crown first, we advise it may be better to start to rebuild the crown and mid-scalp first, because as I told you, the main area that the people see you when you enter the door, when you go somewhere, is this side. So you do it well, you get your identity back. Okay, with the first surgery in Stephan's case, we had the number of 3,250 grafts. 2,600 of these grafts were used for the reconstruction of the front hairline, front forelock, front third, and the temples. And 600 grafts were used to improve the mid-scalp. So it's not high numbers under the normal conditions, but we have to adjust the number we get under the specific angle and direction. So actually when they grow, they overlap with each other. We call it an interlocking pattern. It gives you a better outlook of the hair. And of course, an important point here is the hairstyling. You should do the haircut according to the hair transplant you had. If you will keep your hair very short, of course, the hair transplant at this point may not look like very satisfactory, but when you keep it longer, an appropriate haircut and hairstyling, and will give you a much better outlook. Because as I told you, it's creation mainly of illusion of the hair. It's not hair replacement treatment at this point. So as Stephan explained to us actually, the hair transplant surgery's biggest outcome we see in most of the patients, they gain back their self-esteem. Okay, and they feel themselves much more comfy, and we can see you look much more actually younger. That's very important. And the most important, you look fancy. It's like you're in style now. To what we had and what you have become, it's really a huge difference. You will see that as in the major pictures. We'll be sharing them through the video actually. So, and what's the plan for today? How do you feel?
I feel good, excited, ready to go. Have every faith in you.
Okay, good.
I know you're going to do a good job.
Now, we'll do our best always with all the patients, and let's see how it goes this time. Actually, I'm very happy to see you here back, but I'm the most happy that we have met your expectations. That's very important. When the patient is happy and he or she says, okay, that's what I wanted, or that's what I was expecting to, and that's make me happy. Believe me, for all the medical professionals, doctors, and all our medical team, we always say that if the patient is happy, we are happy. When you have a smile on your face, we smile at our clinic as well. Okay, good to see you back, and we'll be seeing you throughout the surgery, and we'll be starting very shortly.
Thank you very much, my friend.
Welcome, Stephan.